3 years ago, when we started with Atos, we were using settings which were considered by, at that time definition, lower dose because it was under 1 joule per centimeter square. But we need to understand one thing. We are doctors, we're not physicists. So in our minds, energy and dose are interchangeable. We see 100 nanojoule and we see 80 nanojoule. 80 must be less than 100. But just looking at the energy per pulse means nothing unless you're looking at the geometry. How many times this pulse is delivered in an area on the cornea? So those are the spot and track distances. Originally, our power levels were around 900, then we moved to 800, and then with time, we settled at around 600 millijoules per centimeter square. At that power level, most patients are 20/20 or better the next day. But you have those outliers, 15, 20% of people who are 20/25, maybe a little bit worse, and you see there's a little bit of haziness in the cornea. So we started discussing how can we improve those outcomes from lenticular surgery to become as good or better than LASIK the next day. So we said, what if we lower the dose to the cornea to reduce the laser-induced optical breakdown power to the minimal theoretical limit and see what happens. So we started going from 500 to 550 to 500 to 400, and then we found the limit for right now, for my laser and my patients, is around 370 millijoule per centimeter square. That's not the level I would ever recommend anyone daily use. On average, right now my power is 420, and this achieves better than 20/20 vision in over 95% of my patients the next day, which allows me to offer lenticular surgery at the same next day visual quality as LASIK. And in the beginning, when I was offering lenticular surgery, I was offering it as an alternative to LASIK. Now for me, LASIK is an alternative to lenticules. The lower doses allowed my next day visions to be so good that my patients have lenticular surgery as their primary choice because there's great visual recovery speed, almost no next day limitations to what they can do, and it made everyone happier. It made me as a surgeon happier and my patients way happier because they stopped reporting that low contrast quality of vision that was associated with higher doses. Right now, I don't consider low dose as a special thing. I consider it as a standard of care. And I think that as we move along with the lenticular extraction process with other devices and with other surgeons, I think it's important to understand the effect of the dose that's delivered to the cornea for the visual recovery of the patient. And I think that we shouldn't think of low dose as an aberration. We should think of low dose as the standard. Every laser and every surgeon is unique, as every eye and every patient as well. You can't just copy the settings that I use and have a great outcome. What you should do is you should talk to the application specialist who's in charge of you personally and tell them, hey, I want to start exploring lower dosage for my patients. They will then come up with a strategy which will set a power level and the dose level, and then work around finding the perfect settings for you and your individual machine. Usually, I would recommend starting at a power level or a dose level around 550 millijoule, and then incrementally in levels of 50 millijoule, go down until you find that the dissection is now difficult, but the quality of vision is not improving. That should be a quick way of achieving it. You will find that it's a little bit more difficult in the beginning, but you will quickly get used to. You're a doctor, you're a surgeon, you will be able to handle it. If I can, and I've been doing this just for a few years, then you can too. When you say separation is more difficult, I don't say it's impossible. I say that instead of spending 3 sweeps, you might do smaller sweeps and do 6 or 9. But difficult, I would define as taking you longer than 2 minutes to extract the lenticule, making you sweat, making you wound the incision. Those are the definitions of difficult. Difficult doesn't mean you're actually working something and doing something. It just means that you felt exhausted after you've done it. So Don't say when you feel any pressure, oh, it's difficult. No, it's okay. Just try it and you will see. Sometimes also going down might make it easier, which is counterintuitive, but because there are many factors at play, work with your application specialists. They have all the experiences from Zagreb, from Vienna, from Nepal, and they will help you achieve as good results as we are getting right now.